Hi, I'm Dr. Diluni from Mulgrave Dental Group, and today we're going to talk about orthodontics and alignment of your teeth for your children. So what is orthodontics? Well, orthodontics is a specialized branch of dentistry where we focus on correcting the malalignment of the teeth or the jaws that the teeth are sitting in. So usually it's a good idea to bring your children into the dentist at the age of 7. The reason we say that is by the age of 7, they would have had their first permanent teeth come through at the molar area and sometimes in the anterior area. And at this stage, if they have a particular bite that's affecting the growth of the other teeth, or that's malalignment in their jaws and how they're growing, we can actually start to intervene and correct that while your child is growing. Well, it depends on the child. So usually there are particular cases that we decide to intervene pretty early. So usually at the age of 7 or 8, especially if we notice that the teeth are in crossbite and the jaws are not sitting together in the middle and closing down properly. So usually if we notice that the teeth or the jaw is in crossbite, we try to correct this as early as possible, because that could lead to an asymmetry in the top or the bottom jaw growth. And another thing that we try to early intervene is if they've got a narrow jaw. So usually most kids have a suture up in their palate that usually fuses by the age of 10 to 11 in girls and 13 to 14 in boys. So we want to pick up if there's any narrowness in their palate a little bit early, so we can treat that and allow the teeth to grow and come through naturally, so that we can make the treatment thereafter much more simpler and easier. Because sometimes if we don't intervene early, some of these treatments can end up needing jaw surgery or very complicated surgery, which could have easily fixed if we picked the problem earlier. So always we tell parents to bring their kids around the age of 7 so that we can check how their jaws are developing and growing. Now that's a very important thing. When you have orthodontic braces or retainers, you tend to accumulate food and plaque and everything else around there. So it's very important that you get good instructions from a hygienist about how to clean around the braces or the retainers. So usually what we recommend is getting a soft-headed toothbrush, soft small-headed toothbrush, and cleaning on top of the braces, right on top, in the middle and underneath, and taking the time to do it. And sometimes if you're a parent, you might need to actually help your child initially with cleaning around them, and you might need to probably brush at night for them, so that we make sure that we get into all the nooks and crannies and keep the teeth plaque free, so that when the braces and orthodontic retainers come off, the teeth are nice and healthy and they don't have any decay or gum disease. That's all the questions we have for today. If you have any questions, please comment down below and I'll be sure to answer them.